guys, I am Shanmugriya, lecturer from SNS College of Alignment Science in the Department of Operation Theatre and Anesthesia Technology. So today we are going to see a session on case presentation. So our topic is about joint pain. So we have a history of a patient named Madam M.O. who is 65-year-old and she has DM, that is diabetes mellitus, hypertension and dyslipidemia for more than 10 years. She came into an outpatient department on April 3rd, 2016 with the chief complaint of left knee pain. So, what further history would you need to obtain for this patient? So, in the history, we have came to a conclusion that she has a complaint of knee pain for 2 to 3 weeks, and there was no prior history of knee pains. And increasing in pain intensity for the 5 days, rated pain score of 8 for 10. And also the pain was localized on the anterior aspect of knee joint. So the pain is located on the anterior aspect. And no history of trauma or sprain. Then walking and climbing the stairs aggravated the pain. So during walking and also climbing the stairs, the pain ranged more or increased. And the pain was relieved by resting. So next, the knee pain had affected her daily activities and she complained of walking with a limp. No other joint pains were reported. There was no reported locking, popping and giving away of the knee. She noted that the left knee was medially swollen, comparison to her right knee, but could not recall when it started. Morning stiffness of both the knees were reported. The duration of stiffness was less than 15 minutes and then disappeared when she began activities. There was no fever, weight loss or appetite. And next, she has no history of knee injury or surgery. She also has no history of gout, rheumatoid arthritis or degenerative joint disease. And then she has also no family history of gout. She stays with her daughter and the medicines she will taking during these days were amlodipine 5 mg OD, atenolol 50 mg OD and simvastatin 20 mg ON, lorazepam 100 mg OD and metformin 500 mg BD. Then drug allergy was nil. So how do you proceed? Can anyone tell how do you proceed?
Physical examination.
And physical examination.
Okay.
General appearance.
Okay.
Clinically think well nourished day.
Okay.
BP 140 by 90 mmHg. Non-serious P.
It is unremarkable. So we have seen about general examination. Now we are going to identify the examination by using inspection as well as palpation. Who will explain about the inspection and palpation? Okay, Ritesh can lead.
Inspection. No edema, bruising or decolorization of the left knee. This is also no point. Tenderness, slightly bulging is seen on the medial aspects of the left knee joint. Popliteal bulging is seen at the left knee posterior aspects. Musculature on both knees seems systemic bilaterally. There is no bone deformity. On palpitation, the left knee joint is not bound or tender. There is mild effusions left. Range of the movement of the left knee is reduced. Cryptus on both legs were felt. Pedal pluses were all intact.
So how will we diagnose? How will we diagnose? Can anyone explain about the diagnosis? Yeah, Manikanda.
Proper diagnosis: osteoarthritis of knee, acute exacerbations of left knee, differentiated diagnosis: vertical discs, patella female knee joint, degenerative vesicles, rheumatic arthritis or inflammatory arthritis.
How do we manage this type of a patient with this type of knee joint or knee pain? Yeah, Nitya.
Investigations, plain radiography, single view of the affected joint may be
knee pain. Can anyone? Yeah, Maitri.
Knee arthritis treatment options. Non-surgical treatment, patient education and weight reducing, anti-inflammatory medications, supplements, braces, therapeutic injections, visco supplementation, shots, weight loss, walkers, physiotherapy, and the surgical treatment. Treatment, unique compartmental knee replacement, total knee replacement. Knee arthritis, red flag in knee pain, systemic complaints, fever, weight loss, pain at rest, night pain, venting fever, inability to bear weight, extreme of age, logging, bilateral knee pain, other joint involvement, example of hip.
Okay, Maitri. Now we have seen about the case presentation of the topic joint pain. Thank you.